to explain to you what you need to know about the Licking Heights Local School District open enrollment for 2020. This is an active enrollment. That means everybody has to do something at this open enrollment. Even if you're declining all your benefits, you have to take action. We're very excited to announce that for the 5th year in a row, there's no employee increase to the premium for medical, dental, or vision. So how do you go about enrolling in your benefits for 2020? We're offering 3 different methods for you this year. The first being a self-service method, where you go online with Employee Navigator, and you can do that beginning on November the 5th, and that will be open until November the 27th. If you feel that you want to talk to a Gallagher Benefit Services employee who's going to be on site beginning on November 11th through November the 15th, you will need to schedule an appointment through Kimberly Bratz at the district office. Lastly, there will be a call center available for you at the end of November from November 25th through the 27th, and you'll also need to schedule an appointment to meet with those call center employees. So knowing that you must take action means that you need to take the time now to understand the benefits that are offered, and the best material that's available to you is in this benefit guide that will be provided. Let's take the time now to go through it together to better understand what's being offered to you. First, you're going to come to your table of contents. Take the time to understand what benefits are being offered to you. When can you enroll? Open enrollment is the opportunity for you to add dependents, add policies, and make choices to change your benefits for the coming year. If you don't make those changes at open enrollment, you must wait until the next open enrollment unless you have a qualifying life event. As it states at the bottom of the page, if you do have a qualifying life event, you must notify the Treasurer's Office within 31 days of that life event in order to add or change your dependents that are covered on your plans. As an important notice, you must be able to document your dependents, and on page 5 of the guide, it does share with you exactly what will be needed to add those dependents. The next page really helps you understand what opportunities are available for you to go through your enrollment process. The portal will be open on November the 5th and allow you to walk through on your own online the benefits and make your elections that are available to you for 2020. As mentioned earlier, you also have the opportunity to meet face-to-face with a counselor or do a phone call at the end of November. Those are the 3 ways that you can get your benefits elected for 2020, and you can use whatever suits you best. If you go on to the website, you will log on. If you haven't created an account, you'll have to create an account. If you've already created an account, you should be able to log in and go to the first screen and then start benefits to begin the process. So let's start by reviewing the medical plan options offered to you by the district through Medical Mutual of Ohio. We're going to walk through the in-network benefits only, but as you can see, the non-network benefits are listed on this page for you to review as well. It's important that you check the network to ensure that you're staying in network, and you can review your coverages at www.medmutual.com. We highly recommend that you take the time to set up an account to review your claims and your coverage to best understand the programming. Well, let's take a walk through the 2 different plans that are being offered to you for 2020. The first is the base plan. The base plan is a typical copay plan that offers you a very low deductible with some co-insurance afterwards and copays for most services. How does insurance work? Well, the deductible applies to those services that are not covered by a copay. So with this plan, if you had a surgery and you met your $500 deductible for a single, you would then go into co-insurance, the timing where the insurance company pays 80% of your expenses and you pay 20%, until or unless you met an additional $1,000 out of pocket for coinsurance, at which point you would have $1,500 met, and everything else from that point forward would be covered by copays if it were a covered service. So as you can see, you have an emergency room copay of $100, an urgent care copay of $50, a diagnostic office visit for $20, and you can use the Express Care, which is staffed by Cleveland Clinic physicians, to Skype or do telehealth with a doctor when you have an urgent need for $20. These physicians can write you prescriptions, and we recommend that you only use this for common problems that would be easily diagnosed over the phone. There is a brochure that is available to explain all of this to you. I want to also highlight the fact that both plans cover preventive care in accordance with the state and federal law. There are a lot of preventive cares that are covered under your plan, and you should again go to the MedMutual site to review those coverages. I always like to mention to people that there are times when you go for preventive care and you believe that it's going to be 100% covered, that if that preventive care results in a diagnosis, it could mean that you would then be charged for some of the testing and the treatment of that diagnosis. As you can see, also diagnostic lab, x-ray is covered at 100%, also CT, MRI, and the coverage is based on place of service, but in a physician's office is also covered at 100%. The plan offers copays for your medications, and you can see that you can also have the option to save a little money and sign up for a 90-day mail order supply for your medication. To contrast that, the HDHP, or high deductible health plan, that is designed to allow you to be able to contribute to an HSA plan. Of course, you are the only one that can determine your eligibility for opening an HSA, and that eligibility requires that you not be covered by another plan that is not HSA compatible. This plan has a $3,000, $6,000 non-embedded deductible. What does non-embedded mean to you? If you are an employee only enrolled in this plan and you don't have any dependents enrolled with you, $3,000 would be your deductible for this plan. However, if you're enrolled with a family member, any one family member with you as the employee, your deductible is $6,000. The $3,000 does not apply because this is a non-embedded deductible, and the family deductible applies when there's a family enrollment. As you can see, the max out-of-pocket is the same as the deductible. So for any covered service, once that deductible is met and the max out-of-pocket then too would be met, all covered services after that point would be covered at 100%. Keep in mind that the people get concerned or confused about the prescription drug. There's a lot of resources out there these days to help you understand the cost of your medications. One that I recommend is GoodRx, and you can go on that website to look at the cheapest ways and places for you to get your medications at the retail store. Again, I want to point out to you that the per pay deductions for both plans are remaining the same for 2020. Always remember to use your MMO insurance card for all of your services, even on the HDHP plan, because that's how your charges apply to your deductible. And you receive the discounts for the programs that they offer. Again, this year for 2020, the district will be offering to seed or contribute 50% of the deductible into your savings account on your behalf. So if you enroll in single coverage for 2020, the district is going to, over the course of the year, beginning in January, contribute $1,500 into your account. If you enroll with a dependent, the district will contribute $3,000 into your account. You must reduce your contribution annually by the amount that the district contributes for you and can only contribute up to the annual maximum for the year. For 2020, the contribution maximum is $3,550 for a single person enrolled, and for a family member or those people enrolled with any dependent, you can contribute up to $7,100. If you are 55 years and older, you can contribute an additional $1,000 annually. Keep in mind, there's a lot of different ways you can use your savings account. The IRS is who mandates the usage and the ability to set up an account. There's a lot of information contained on these pages and a lot of different publications that the IRS provides for you to understand. The basic things you need to know is this is an account that belongs to you. It does not belong to the district. You can use it for your out-of-pocket medical, dental, and vision expenses as long as you qualify for the account and are enrolled in the HDHP plan. Please take the time to review all of this. If you enroll in the HDHP, you are not eligible for the flex spending account because you have a health savings account. Again, take the time to review the rules and make sure you understand how the plan works. Next is a lot of information about deciding and helping you determine which plan is best for you. The district is giving you the opportunity to pick from 2 plans. However, because of their commitment to you in moving to the high deductible health plan and their contribution into your HSA account, there is no moving back to the base plan once you take the high deductible plan coupled with the HSA. You must stay on the HSA plan from that point forward. The district offers you dental coverage with Delta Dental. They are a premier carrier of dental coverage and have one of the best networks in the country. They offer you 2 different networks that are considered in-network. The first is the PPO dental network, and the second is the Premier. The PPO network is where you're going to get the best discounts and the best out-of-pocket. The Premier network could cost you a little more. However, there is no balance billing. With a non-participating dentist, you could end up with balance billing or out-of-pocket above and beyond, even when something was covered at 100%. So let's walk through how this coverage works. The plan has a $1,000 annual maximum per person enrolled on the plan. Your diagnostic and preventive is covered at 100%. Minor restorative, as we walk down through, is covered at 70%, and your major restorative is covered at 50%. Braces have a 50% coverage or orthodontia up to a $1,000 limit. You can review the network at www.deltadentaloh.com to locate an in-network dentist. Some exciting news that I want to touch on the dental is that we were able to add dependents this year up through age 26 in order to match the eligibility with our medical plan. So your dependent children can remain on your dental plan until the end of the month of their 26th birthday. Again, no change to those per pay deductions for the employees. Walking through your vision plan is provided by the carrier emeritus with the network of VSP. Again, we've moved the dependent age up to 26, so your children can remain on the plan with no student requirements for both the dental and the vision up through age 26. This plan provides you with an annual eye exam with a copay of $10. You can get your lenses or frames for a $25 copay And then all of your lenses after the copay would be covered in full, and your frames would be covered then up to that $120 allowance. If you prefer to have contacts, you can have the fit and the follow-up exam for the cost of $60. You can get your elective lenses up to $120, and then your medically necessary would be covered in full. The frequency is every year, so every 12 months you can have an exam, a lens, or a frame. Keep in mind you can get glasses or contacts, but not both in the same year. The program also offers some discounts off LASIK if you choose to get that procedure done. Again, no change to the cost for the vision for 2020. Moving on to your Employee Assistance Program, we have a wonderful program at Licking Heights Local Schools called Impact Solutions. It's a program that's provided to you by the district free of charge, that's available for professional, confidential support 365 days of the year. We know in the insurance world that a visit with a counselor can cost $125 or $150 an hour. This program will offer you 3 face-to-face counseling sessions per person, per occurrence, with a certified counselor to discuss your issues. They also offer financial services, identity theft, which both includes preventive and post-theft assistance, free of charge for you. Who is eligible for this program? This program is offered to all employees, regardless of whether they're enrolled in any of the benefit plans. All of your household members, so your spouse, your children, in and away from home, your parents, your in-laws are able to use the services of Impact. This program is again offered for you for the benefit of any problems that you might have with work, personal, financial, just looking for legal assistance. We recommend that you either log in or call them to utilize the services of this benefit that doesn't cost you a thing. Impact Solutions sends a monthly newsletter that HR forwards to all of you with current topics that are really relevant to what's going on in the world. It also will help you to understand better how to log on. So take a look at this monthly newsletter as it is sent out by Human Resources. So let's move on to looking at your life insurance. The district does provide you with a $30,000 basic life and accidental death and dismemberment policy through One America. This policy is provided to you at no cost through the district with the carrier of One America. I always think that it's a great time to double check your beneficiary and make sure that you have your beneficiary on file that you would want to receive your life insurance money should something happen to you. You also have the opportunity to buy supplemental term life. I want to mention that if you don't elect to buy additional voluntary life when you're first eligible, you could be requested to complete medical questionnaire if you try to enroll in the program at a later date. This plan offers you as the employee to buy life insurance at the increment of $10,000 to a maximum of $500,000, as long as you don't exceed 5 times of your covered annual salary. You can also elect to insure your spouse in increments of $5,000 to a maximum of $250,000. That benefit cannot exceed 50% of the benefit that you elect for yourself. There is a guaranteed issue for a spouse of $25,000. The supplemental life is offered at $2,500, $5,000, or $10,000. The rates are provided below for you to calculate the cost of this program to enroll yourself, a spouse, or your children, and again is based on your age, and you would pay 100% of the cost for this life insurance. Just as a reminder, this is also offered through One America. Now let's talk a little bit about the flexible spending account. There's a medical flex spending account, and we use American Benefits Group to administer this savings account for you. This account allows you to put away pre-tax dollars for medical expenses for you and a qualified dependent, and is only eligible to be enrolled by those people who enroll in the base plan. We know that because people who enroll in the high deductible plan will have an HSA account, and so therefore they're not eligible for a medical FSA. The maximum contribution that you can make to this account is $2,700, and you can use it for those out-of-pockets such as copays, deductibles, all of the other things listed. One of the changes that came along with healthcare reform is that we're no longer able to use over-the-counter medication expenses for our FSA. However, if you take allergy medicine and you get a prescription for that allergy medicine from your physician annually, and you put that in your record or your HSA file, you can then reimburse yourself from your account for your over-the-counter allergy medicine. Please refer to the American Benefits website for any questions about what reimbursable expenses are from your FSA. Secondly, we have a limited purpose FSA, which is available to those who enroll in the HSA plan or the HDHP. What is this plan? This is a way for you to save flexible spending money that allows you to spend that money on dental and vision expenses only. So that allows you to save the money in your HSA account for future medical expenses, but having this other tax advantaged account for vision and dental purposes. You would only really want to consider doing something like that if you knew you had a lot of expenses in the year coming up for those dental or vision needs. Lastly, I'd like to touch on a dependent care FSA. This plan is available to those enrolled in either plan. It is separate from medical and is specifically for daycare expenses for children up to the age of 13, or for elder dependents like aging parents that you may be responsible for. Again, you can contact American Benefits to get more details of what is covered, but the maximum contribution is $5,000 annually, and you must be able to provide them with tax identification numbers for those people who are taking care of your children. So again, there's 3 different types of spending accounts that you can enroll in. The first one is medical, for those people who are enrolled in the base plan. The second is a limited purpose for those enrolled in the high deductible health plan. Those 2 plans will allow you to spend the money before you accumulate it. The dependent care, however, is different from that, and you can only utilize the spending account with the funds that you have already contributed. So in other words, if I'm going to withdraw $500, I must have $500 already in the account. So now we're going to hit on a lot of the voluntary programs that are offered to you. And when we say voluntary, what that means is they're programs that you decide to elect for yourself, and you pay 100% of the premium or the cost for these programs. The first program that I'm going to touch on is Lincoln's Voluntary Short-Term Disability. Lincoln actually offers 2 plans to the district for you to select what might be best for you. The first program is a program that has 7-day elimination period for sickness, accident, or pregnancy. So what that would mean is after you are out, unable to work for 7 days, the policy would begin paying you 60% of your weekly earnings up to a maximum benefit of $2,500. The second program is for those people who have probably built up a little larger sick bank, and it would have 30 days of disability before your benefit would kick in, and the benefit only lasts up to 22 weeks. Keep in mind you can enroll in this program at open enrollment, but if you have a pre-existing condition or anything that you've received medical treatment or advice for in the last 3 months prior to enrollment or effective date, those items would not be covered for the first 6 months of the policy. In the 7th month, they would be covered, but keep in mind there is a pre-existing condition clause for the disability. The bottom part of this page has the method to calculate the cost for the coverage, and also you can verify that by the enrollment system calculating that cost for you as well. A very important additional benefit is for those people who want to have voluntary long-term disability. This is a disability that would have an elimination period of 180 days. So once you would be out, unable to work for 180 days, on the 181st day, your long-term disability would kick in, should you elect it, and reimburse you 40% of your monthly earnings up to a maximum of $5,000. Again, this policy has a pre-existing clause. I recommend that you review it and think about what you've received treatment for in the past. And then you can use the table below to calculate the cost of the coverage for you for 2020. This will also be calculated by the enrollment system for you to be able to verify your expense for that program monthly. Again, those are long and short-term disability programs. So we also have some programs with Transamerica. We have an accident plan that offers you a long-term care insurance. That is if you end up in the emergency room, if you end up hospitalized, you have a fracture, any of those accidents or sports-related injuries that you or a family member might incur. Again, these are voluntary programs that you pay 100% of the cost of. They don't run through Medical Mutual. This program is offered through Trustmark, and the cost per pay are listed below. This program offers also dependent coverage up through age 26, and that again is the month of their 26th birthday. So these benefits are paid directly to you regardless of the medical plan that you're enrolled in, should you have an accident while covered. Critical Events through Transamerica is a program that again also pays you for heart attack, stroke, or cancer. These plans will reimburse you for these diagnoses and are outside of the medical plan, but pay you a lump sum cash benefit for the out-of-pocket expenses that you may be experiencing due to these issues. I want to remind you, if you have this policy, there is also a $100 wellness benefit that you can collect on each calendar year. If you have a wellness benefit screening, you can get a $100 refund or check for just submitting a screening test each calendar year for one of the wellness screenings listed below. Universal life. So earlier we talked about term life. Term life is purchased for a specific period of time and gains no cash value over that period of time. Universal life is a permanent life plan that is designed to add cash value and have a death benefit as well as a living benefit. It has a long-term care rider, which is really important to people as we approach those older years, that allows you to use some of the benefit for a long-term care facility. This benefit can only be enrolled by using the call center enrollment. So November the 25th through the 27th, if you would like to enroll in the Universal Life, you would need to make an appointment to speak with a call center employee during those dates. You also have access to LifeLock, which is one of the leading companies in identity theft protection. They will protect you before and do monitoring of all of your account prior to, and then assist you should you have a problem as well. There's a lot of different value adds to their plan. I recommend that you take the time to review it, and the cost again would be paid 100% by you should you decide to enroll. Just as a reminder, as we mentioned earlier, Impact Solutions offers as well an opportunity for you to review their identity protection too. We have all the contact information. We want you to be good consumers of your products, and some of that can be asking the right questions of the right people. Feel free to reach out to any of the carriers to better understand your questions and or our office to better understand these programs.
If they forget their username and password, how do they log in and where do they get that information?
You can get your username from either the treasurer's office with Zach, or you can email Kimberly Bratz in the Human Resource Office. And also there is a link to Forgot My Password.
And how long can I cover my children?
So your dependents can be covered on medical, dental, vision up through the end of the month of their 26th birthday.
How do I add or remove a dependent?
So you're going to do that online with the Employee Navigator program, but if you're adding a dependent, you're going to want to review the benefits guide on adding or terminating dependents, which is on page 5 of the guide.
Can I make changes after I complete my open enrollment?
No, once your open enrollment is completed, those elections will remain in place until the next open enrollment unless you have a qualifying life event.
If I do not want coverage, do I have to do anything during open enrollment?
This is an active enrollment. That means everyone who is benefit eligible must take action to elect or decline the benefits for the open enrollment.
Okay, if I take the HSA in 2020, then for 2021, can I go back to the base plan?
No, the district has decided that based on the commitment and the contribution into your HSA account on your behalf, that once you move into the high deductible health plan, you cannot move back to the PPO plan.
And can you talk about the difference between the FSA and the HSA? My understanding is the HSA, if I would leave Licking Heights, goes with me, but the FSA is annual. Can you address that?
Yes. So an HSA is a personal savings account. The employee is always the owner of that account. That always can go with them, and the district cannot withdraw funds from that account. The FSA is a use it or lose it account, and if you leave the district, unless you were to elect COBRA, you would no longer have access to the FSA.
And one final question deals with Impact Solutions. Because that is a free program that we offer to our employees, can you tell me again who is eligible to use Impact Solutions?
All employees, whether or not they're enrolled in any benefit programs, all employees have access to Impact Solutions and the benefits of their programs. All dependents, all parents, your in-laws, anyone who lives in your home can access the programs through Impact Solutions. So in closure, thank you for joining me today. I hope that you take the time to make sure you understand exactly what you need to know for open enrollment for 2020. Please feel free to reach out to Kim, or Zach, and they will let me know if they have questions that they need my assistance with. Have a great school year. Thanks again.